Thanks for tuning in to the Red Clinic podcast. I'm Dr. Schwalen, licensed psychologist and expert in the treatment of eating disorders, and today we're going to do what we do best. I started a series where I was outlining specifics about different eating disorders. 2 weeks ago, I covered the specifics about anorexia nervosa. Last week, I covered bulimia. And this week, I'm going to talk about OSFED, or other specified feeding or eating disorder. This is a very big category of eating disorders in the DSM. And remember, that's the Diagnostic Statistical Manual that us clinicians use to help us diagnose different things. And we shorten it to the word OSFED, O-S-F-E-D. There are different types of eating disorders that fall under this umbrella. And pretty much that's what it is. It's kind of like this catch-all. It's when people have eating disorder or disordered eating patterns and behaviors that don't necessarily fit into one single category. So there might be something or a few things that just don't add up exactly. And so then we would put it into this category in order to just understand it and know what to do with it in terms of how to move forward with treatment planning. And so the first eating disorder that I'm going to talk about today is actually one that we commonly see at the Red Clinic, and it falls under the OSFED category. It's called atypical anorexia. So if you tuned in a couple weeks ago and you heard me talk about anorexia in its entirety very specifically, essentially someone with atypical anorexia meets most of the criteria for anorexia nervosa, but there is just one specific thing that's really different about them. And so I'll go into that detail here in a minute. And because of that detail, they actually then don't meet criteria for anorexia. We would call it atypical anorexia. So let me just review what some of those criteria are. So basically, whenever someone out there is, acting as a clinician who can do some diagnostics, they're really looking to see if the problems that a person has are impacting them across several domains. That's really how we know that this isn't just a phase that someone's going through or some kind of stage in life, but this is truly a clinical disorder that we can diagnose and effectively treat with a treatment plan. So we're looking at, do the symptoms affect someone not just at home, but at work or at school? Is it affecting how they're getting their job done or even how they're interacting in relationships? That's really how we're thinking about someone's functioning across domains in order to determine if this rises to the level of a clinical disorder. And so it's the same thing with an eating disorder. We really want to look to see how much impact is this having on someone's life and across different settings and in their relationships and how they're getting by just in the day-to-day. So with atypical anorexia, that's what we're going to look at. Feeding or eating, is it affecting them everywhere? How they think and what they're doing. And then we're also going to see that they have a fear of weight gain, just like with anorexia, and that the person is also doing something that would be considered pretty unhelpful or unhealthy to prevent weight gain. So someone with atypical anorexia is going to do most of the same things that someone with anorexia would do. There's that restriction of caloric intake, right? So not eating enough or often enough or going long periods of time with restricting and not eating at all. Maybe some calorie counting behaviors or dieting behaviors, a fixation on food and appearance, and so this overall dissatisfaction with the way they feel about their body. And then also, all of those criteria are met except for the fact that they're still in or above their normal weight range. Most of the time, someone with atypical anorexia is, when they present, has been engaging. So when I say when they present, like when they show up in my office or to a different clinician's office and they're saying like, hey, I don't feel good and I really need some help. That's what I mean when I say when they present. So if someone comes to my office and they present with some disordered eating patterns of fear of weight gain, restriction, overexercise, counting calories, preoccupations with just wanting to look a certain way and really doing everything they can to prevent weight gain, and they're still in their healthy weight range or they're still above their healthy weight range, they would actually meet criteria for atypical anorexia. Now, the worst case that I've ever seen of this, and I use this example often to kind of get the point across, because a lot of people will say, well, if they're not underweight, do they really have an eating disorder? Or they're just not sick enough. It's not a big deal. Why are we making this such a big deal? And I want to point out that this is actually can be a very big deal and a very serious thing. So the most significant case that I've ever seen of this was a 16-year-old male who was very tall for his age. He was probably over 6 feet tall. And he had actually presented at the time of his appointment over his healthy weight range. So he wasn't in it yet and he wasn't under it yet. He was still over it. However, in the last year or even less, he had lost 100 pounds. And for someone to lose that much weight in a very short amount of time, usually it's because they're engaging in a lot of these really unhealthy or pathogenic dieting behaviors. So restricting caloric intake, becoming so malnourished that he was absolutely having some of those medical complications that I reviewed in the last 2 episodes, and dropping weight very quickly. When he presented, he also presented in a wheelchair because at that point he had developed neuropathy in his legs just from being so malnourished that he was to the point where doctors thought he would never walk again. So weight is also not necessarily an indicator of how sick someone is, right? A lot of people with anorexia will say, well, I'm not skinny enough, or I'm not thin enough, or I'm not as thin as, so there's no way I could be that sick. With atypical anorexia, someone doesn't have to be underweight in order to be extremely trapped by their eating disorder. Other examples that I've seen of this are teenage boys, teenage girls, adults who have atypical anorexia. And so I like to say usually, we caught the disorder before it got so bad that they started to see even more side effects of malnutrition or becoming emaciated. Because if they didn't receive treatment, that's probably the path that they would have gone on. Another example that I really like to bring up, and this is kind of controversial, but I'm going to do it anyways, is the show that used to air, I don't even know what network, it doesn't matter, but it was called The Biggest Loser. And there was a contestant on that show who actually presented in her, well, technically, because they were using BMI to measure her health, she presented in the overweight range if we're looking at BMI. But she was maybe like half a point over, and she was still classified as overweight per that number. And it'll be a whole nother episode, but we're going to go into like our soapbox about BMI in the Red Clinic. Anyways, her name was Rachel Fredrickson. I don't really know where she's at today. I should look this up, right? But she presented to that show in the overweight BMI range, and 13 episodes later, she was in a like healthy weight range. So she was considered in her normal weight. And then by the 16th episode, which according to that season, like that's the amount of shows they have in one season, she won the show, but she was considered to be in an underweight BMI. So if there's really a week between episodes, which I don't really know, I don't know the length of an actual show and what it takes to shoot episodes and all of that. But in a very short amount of time, she went from presenting as overweight to then being underweight. And someone with my background, knowledge, expertise understands exactly how she did that. She restricted caloric intake. She probably was over-exercising. She was obsessed with it and did everything she could essentially to win that show. Now, someone like her would have been considered in the atypical anorexia category at episode 13, right? If she was like, I can't stop in my behavior pattern. I don't feel good. I'm dizzy. I'm blacking out. These things are happening to me. I need help. But then 3 weeks later, she presented and she would have probably met criteria for anorexia. I like bringing that example up because she got a lot of praise. She got a lot of attention. She won the show, so I think there's some monetary reward for that as well. After the show was over, she was interviewed by big news shows like Good Morning America, and it was reinforced over and over again that she did this great thing by losing all this weight. And the other thing is when she was interviewed, a lot of the things that she said were things like, I've never felt better. I'm the happiest I've ever been. All my dreams are coming true. And so America got to see, and the world got to see that, happiness is revolved around being thin and losing weight and going on a diet. Those associations are made every day in our society. And the most interesting thing about treating somebody with atypical anorexia that I really like to pinpoint is that that person, unlike someone with regular anorexia, has actually experienced what life is like in a larger body. Okay, most people with anorexia haven't. The fear of weight gain or the fear of being fat is more of an irrational fear. It's not ever something they've actually truly experienced. But the person with atypical anorexia has experienced that. And so in treatment, it's really, really important for clinicians to understand this difference because it's a big deal. To talk to somebody about, hey, our treatment recommendations are actually not to be on a diet, not to overexercise or do all these things to keep losing weight. In fact, it's the exact opposite. Right now, it's to just eat the food that's outlined on your meal plan and limit your activity until we can heal your insides and heal what association you even make with exercise, because right now you're not finding any joy in it. We've got to get the quality of your life back so you can start feeling better from like all aspects of the word health in terms of psychological, mental, social, emotional, spiritual, all of those terms. And the person with atypical anorexia is going to look at you and say, so basically you're asking me to do the things that I did before when I was fat or before I lost all this weight, and I'm not okay with that. And so to really address that in therapy is so, so important. And I always make it a point to do that with someone who has the diagnosis of atypical anorexia of, tell me about what it was like when you did lose the weight. Most people will say what happened to Rachel Fredrickson happened to them. They had a lot of praise and social acceptance. They reaped the benefits of that. All of a sudden, they had more friends or they felt more confident. And in therapy, we have to show them that actually you were you the whole time. The person who made friends, the person who felt what it was like to be confident, it was the same person the whole time. It didn't matter, really. The only thing that mattered is that it was you. You were the one who was doing all that, not your body or not the fact that you lost all this weight. And getting them to understand that and believe that to their core is really where the work in therapy has to happen. Helping them trust their body and helping them stop interfering or getting in the way of its functioning in a healthy way is also really important in therapy. So atypical anorexia is actually one of my most passionate disorders to treat just because of those nuances. It is really interesting to sit there across the therapy room and talk to someone about what life was like in a larger body and the responses that they got when they did lose the weight, even though it wasn't in the healthiest way. And then also to really explore the fact that, even though on the outside it looked like they were doing better, on the inside they didn't actually feel any happier. It's a lot to keep up with when you're engaging in an eating disorder. So that's it for atypical anorexia. With regard to medical complications, a lot of the medical complications are very similar, like I said, to the ones I've already outlined in the past, so I'm not going to go into those again. But it's always really important that your provider has the knowledge of those things in the forefront of their mind, can also collaborate with other providers out in the community, like medical doctors and psychiatrists, so that those things are being monitored if you or your loved one is struggling with atypical anorexia or any other kind of eating disorders. There you have it. That was our Red Clinic podcast for today, and I can't wait to see you again next week. Thank you so much.